the sooner we get you to take this exam, the better. I mean, the worst thing that you can do right now with all this time off and just like delay is not prepare for it. And I can't stress that enough. So on this test, you guys are going to be doing the cognitive exam, which is right here in the middle. To apply for it, obviously right underneath, it says apply for this exam. Just about this exam. National Registry, EMT, cognitive exams, a computer adaptive test. That's the first thing it says. Now, what adaptive means is if you start performing well on a question, it'll change the difficulty of the question. I'm not saying perform like shit so you just have easy questions throughout the entire thing, because that's how you're going to fail. And typically how this works, for example, let's say you're doing respiratory management and you get an easy question about breaths per minute and you get it right. Next question that you're going to get is going to be an airway management question, but it's going to be a little bit more difficult. So whoever's making this exam, they kind of have a team of people who categorize different questions and the difficulty of those questions. Now, the number of items a candidate can expect on the EMT exam will range from 70 to 120. Don't think that everyone's going to have the exact same amount of questions. And how that works is, you know, ACE might get 85 questions, and when you get 80 questions or so, it's going to be, you're going to be like, holy shit, I either killed it or I got killed. So don't think that you smoked it just because you got 80 questions. But how that's going to work is once they see that you're good with airway management, they're going to move on to cardiology, right? And you have to complete a certain amount of questions correctly to move on to the next subject. That's why it's adaptive. Each exam will have 60 to 110 live items that count towards your final score. The exam will also have 10 pilot questions. This is where it gets kind of weird, that do not affect your score at all, but you are not going to know which question is a pilot question. Okay? The maximum of time given to complete the exam is 2 hours. The exam will cover the entire spectrum of EMS, including airway, ventilation, cardiology, trauma, medical, OB with gynecology, EMS ops. Items related to patient care are focused on adult and geriatric patients, which is 85% of your exam. 85% of your exam has to do with adults. 15 is peds. However you want to think about studying for this by those numbers, you know, that's the majority of your questions are going to be based on adults and geriatrics. In order to pass the exam, candidates must meet a standard level of competency. The passing standard is defined by the ability to provide safe and effective entry-level EMS, or emergency medical care. But now let's look at how this test is broken up in different categories. Now, we said the different categories, but airway management is going to be up to 22% of your grade, right? Cardiology is going to be up to 24%. Trauma, 18. OB, the highest percent of your test is going to be based on OB questions, okay? Up to 31% of your test grade. And then EMS ops is the least amount of up to 14%. Retest. Can you retest if you fail it? Absolutely you can. But understand that you don't have unlimited retest times. You can only retest this thing up to 6 total times before you have to retake this entire program all over again. Please don't think that that doesn't happen ever, because there are students that struggle with this test. All right. If a candidate is not successful in this cognitive exam, National Registry will provide a candidate feedback on their performance. Basically what they tell you is where you are passing and where you are not passing. So they're going to break it down into these different categories, and then they're going to say, hey, your trauma was not passing. Your cardiology was near passing, but you didn't pass. And your airway management was passing. All right. So then you could kind of look at that and say, all right, well, near miss on cardiology. So let me hit some of that. And trauma, I did terrible. So I'm going to really hit trauma. Candidates can reapply for their exam 15 days after the examination. So you have to wait a grace period of 15 days after you fail to reapply. Candidates are given a total of 6 opportunities, like I said. After 3 attempts, if you fail the 3rd time, candidates must submit official documentation verifying completion of a remedial training class. Remedial training must be completed by a state-approved instructor or an approved CAPCE course. After remedial training is complete, the candidate is given 3 additional attempts to pass this exam. But our goal is to not have to get to this part, all right? It sucks having to retake this exam. You know, it's discouraging. And also there is an exam fee of $80 per attempt, okay? Understand that you want to knock this thing out ASAP. Must have completed the course within the past 2 years, and the course program director shows that you have a successful completion on the National Registry website. So basically you have 2 years technically to do it. My recommendation to you is to do it as soon as possible. I'll give you some advice. I'm going to be doing some test prep stuff. For those of you who have been hitting test prep on JB Learning, it's great. There's a lot of test questions from it. The more test bank questions you get, the better. The thing that screws people is once they know the test bank and all they do is memorize it. I mean, shit, you know, it ain't going to do nothing for you once you get there. And, and you don't have no idea how many students I talk to or try to go over like some questions. And they're like, the second that a test prep question comes up, they already know the answer without even having to read it. And it's like, dude, you just memorize the test. Like, how do you think that's going to help you? Because you ain't going to see the same questions again. I guarantee that.